Okay, so this time you've given us a really interesting stack of stuff, and it looks like mostly your notes and study guides all about neurological conditions and injuries.
Mm-hmm.
You've even bundled it all up and labeled it Neurosystem Quiz #2.
Right.
So our mission in this deep dive is to cut through all of this material
Okay.
and pull out the most important connections and distinctions so you can really understand everything from the impact of like a head injury
Yeah.
to the intricacies of things like strokes, seizures, brain tumors, and a lot more.
That sounds great.
We're going for those aha moments that make it all click.
I love it. And I think what's so fascinating as we look at all these different conditions is just how interconnected the nervous system is
Yeah.
and how a disruption in one area can really have such varied and sometimes surprising consequences.
Totally.
So I think in this deep dive, it's not just about what these conditions are,
Okay.
but also some of the key underlying mechanisms,
Right.
and what makes each one unique.
Okay, so let's dive in.
Let's do it.
First up, head injuries.
Okay.
Your notes categorize these by how they happen,
Yeah.
which makes a lot of sense.
Right.
So we've got acceleration injuries first.
Okay.
Think sudden external force, like being hit with a baseball bat,
Mm-hmm.
causing the brain to move rapidly within the skull.
Yeah.
Then we have deceleration injuries, like hitting your head on the dashboard.
Right.
Head stops suddenly, but the brain keeps moving forward.
Ooh.
Then rotational injuries, things like whiplash,
Uh-huh.
where the brain kind of twists inside the skull.
Yeah.
And finally, penetrating missile injuries.
Okay.
So that's like a bullet entering the brain tissue.
Yeah.
Quite a range of forces involved here.
It really is. And, each of these mechanisms kind of tends to produce different patterns of injury.
All right.
For instance, with a rotational injury, you might see more widespread damage
Okay.
to the nerve fibers kind of throughout the brain.
Right.
We call that diffuse axonal injury
Okay.
because of those shearing forces.
Oh, I see.
And this is different, right, from a penetrating injury
Yeah.
where the damage is often more localized
Right.
along the missile's path.
Along the path. Okay.
Although,
Yeah.
obviously, that can be devastating,
Sure.
depending on the area affected.
Right. Okay. Scalp injuries.
Yeah.
Your notes are pretty clear here.
Yeah,
Primary concern that jumps out is the risk of infection.
definitely.
Seems straightforward.
Yeah.
But you point out the scalp has a rich blood supply.
Mhm.
So even small cuts can bleed quite a bit.
You got it.
And the key takeaway here is thorough cleansing,
Right.
irrigation, get rid of any contaminants,
Yeah.
followed by closing the wound with either sutures or butterfly dressings.
Exactly.
It's all about preventing bacteria from taking hold.
Precisely. While that good blood supply helps the scalp heal,
Right.
it also means any break in the skin is an entry point for infection.
Makes sense.
So meticulous wound care is really critical.
Right.
To avoid complications
Okay.
that could spread.
Makes sense. Skull injuries, you differentiate between open and closed.
Right.
The crucial difference here is whether the duramater, that tough outer membrane that protects the brain,
Yeah,
is torn or not.
exactly.
So open skull injuries can occur with fractures, penetrating trauma.
Mm-hmm.
The risk of infection here is significantly higher.
For sure.
And you even list some red flags in your notes.
Okay.
Bleeding from the nose,
Uh-huh.
pharynx or ears,
Yeah.
something called battle sign, which is bruising behind the ear,
Right.
blood in the conjunctiva, the white part of the eye,
Mm-hmm.
and even leaks of cerebrospinal fluid, CSF.
Yes. Yeah.
That all sounds very serious.
It is serious. The presence of CSF,
Right.
that fluid that surrounds and cushions the brain and spinal cord,
Right.
leaking out indicates a direct connection between the sterile environment of the central nervous system and the outside world.
Oh, wow.
And this, of course, dramatically increases the risk of meningitis,
Yeah.
which is a serious infection of the membranes surrounding the brain and spinal cord.
Oh, okay.
So battle sign and the other symptoms you mentioned are strong indicators of what we call a basilar skull fracture,
Okay.
which is a break at the base of the skull.
Hmm.
And it requires careful monitoring
Okay.
for these very reasons.
Okay. Closed skull injuries.
Okay.
Now, the duramater remains intact.
Uh,
And here your notes cover some important concepts.
yeah,
Coup versus counter-coup.
right.
Coup is the injury right under the point of impact.
Exactly. Where the head hits something.
Counter-coup is when the brain rebounds inside the skull
Yeah.
and hits the opposite side.
Hits the opposite side. So it's like a double impact in some cases.
All right, that double whammy.
Yeah. And the brain is essentially floating within the skull.
Right.
So a sudden force can cause it to move and collide with the skull, on both the initial impact
Right.
and then the rebound.
Right.
So what's key to understand here is that the symptoms the patient shows might not directly relate to where the head was struck,
Oh, interesting.
because the counter-cue injury
Yeah,
can sometimes be more severe
I see.
or in a more critical area of the brain.
Okay, so that's something to watch out for. You also discuss concussion, that shaking of the brain.
Right.
And the symptoms you list here are pretty broad, ranging from a temporary loss of consciousness and loss of reflexes to respiratory arrest, amnesia, visual disturbances, and an unsteady gait.
Right.
It really highlights how even what might seem like a mild head injury can have significant and widespread effects on brain function.
Yeah, concussion, while often referred to as mild traumatic brain injury,
Okay.
actually involves a disruption of normal brain activity.
Okay.
And the forces involved can stretch and damage brain cells,
Oh, wow.
affecting everything from memory to balance.
Wow.
So it's crucial to remember that repeated concussions can have cumulative and long-lasting effects on neurological health.
That's really good to know. Then there's contusion,
Mm-hmm.
essentially bruising on the surface of the brain.
Right.
And your notes point out that these can lead to permanent damage, potentially causing changes in mental function or even seizures later on.
Yeah.
It's a sobering thought that even a bruise on such delicate tissue isn't something to dismiss.
No, you're absolutely right. Contusions actually involve bleeding into the brain tissue,
Okay.
which can cause swelling and damage to neurons.
Right.
So depending on where these bruises occur, the long-term consequences can vary significantly,
Mm.
from subtle changes in personality or cognitive abilities to more noticeable issues,
Okay.
like motor weakness
Mm-hmm.
or the development of epilepsy.
Wow. Okay. Finally, under closed head injuries, you mentioned laceration.
Yes.
The tearing of brain tissue itself. And
Yeah.
that sounds like a much more severe form of injury, likely associated with significant trauma.
Yeah. Lacerations represent a direct physical tear
Okay.
in the brain tissue, while the dura might still be technically intact in a closed injury.
Right.
A severe blow can cause the brain to move forcefully
Okay.
against the sharp edges of the skull
Yeah.
or bony ridges inside, leading to these tears.
Okay.
So these injuries carry a high risk of permanent neurological deficits.
Okay. Let's talk about some of the complications of head injuries now.
Okay.
Hemorrhage or bleeding is obviously a major concern.
Absolutely.
And you detail a few types, starting with epidural hematoma, which often results from blunt trauma.
It does.
And the symptoms you list here, a decreased level of consciousness, headache, seizures, hemiparesis, weakness on one side of the body, decerebration, a specific type of abnormal posturing, indicating severe brainstem dysfunction, and dilated fixed pupils.
Yeah.
All sound incredibly serious and like they would require immediate medical attention.
Absolutely. Epidural hematomas
Yeah.
typically occur when there's a skull fracture
Okay.
that tears one of the meningeal arteries,
Right.
often the middle meningeal artery. Okay.
And because it's an artery, the bleeding is rapid,
Wow.
and the blood accumulates between the skull and the dura mater.
I see.
So this rapid increase in pressure inside the skull is what leads to those quickly progressing and severe symptoms.
Right. So the pressure builds quickly.
It does.
Next is subdural hematoma.
Okay.
You link this to a ruptured meningeal artery after a skull fracture as well.
Right.
You mentioned it causes immediate pressure on the brain, and while small hematomas might be reabsorbed by the body, larger ones often require surgical removal.
Right.
So what's the key difference here in how these typically present compared to epidural hematomas?
So while epidural hematomas are usually due to arterial bleeds
Okay.
and have a faster onset of symptoms,
Yeah.
subdural hematomas often result from the tearing of bridging veins.
Okay.
These are veins that connect the surface of the brain to the venous sinuses.
Mhm.
Venous bleeding is generally slower,
Makes sense.
so the symptoms of a subdural hematoma can sometimes develop more gradually.
Particularly in what we call chronic subdural hematomas. I see. However, an acute subdural hematoma, especially after a high-impact injury,
Right.
can also cause a rapid decline
Okay.
in neurological function.
Got it.
And the location of the blood collection beneath the dura mater also contributes to this different clinical picture.
Okay. Then there's intracranial hematoma,
Mm-hmm.
bleeding directly into the brain tissue itself.
Right.
And you mentioned uncontrolled high blood pressure, shearing forces as potential causes.
Yes.
And the significant danger of this bleeding expanding rapidly and leading to coma?
Yeah,
This sounds particularly challenging to
it
manage.
is. Intracerebral hemorrhages can stem from various causes, including hypertension,
Okay.
which weakens blood vessel walls,
Right.
trauma causing direct damage, or even the rupture of aneurysms or arteriovenous malformations.
Right.
So the bleeding within the brain parenchyma
Yeah.
can directly destroy brain cells
Right.
and also cause significant swelling and increased intracranial pressure.
Okay, so that pressure issue comes back again.
It often does.
Finally, under head injury complications, you discuss cerebral edema,
Mm,
the swelling of the brain that can lead to increased pressure and decompensation.
yes,
You note that an early sign can be restlessness,
it can be.
and you also give the normal range for intracranial pressure as 10 to 20 millimeters of mercury.
Right.
That restlessness seems like a subtle but important early indicator that something might be going wrong.
Yes, restlessness can be one of the first signs that the brain is starting to swell and the pressure inside the skull is rising.
I see.
And as the pressure increases beyond that normal range, it can impede blood flow and oxygen delivery to the brain,
Oh, wow.
leading to further damage
Okay.
and a worsening of the patient's condition.
So that's a key thing to monitor.
It is. Monitoring intracranial pressure is a critical part of managing severe head injuries.
Okay, let's shift our focus now to brain tumors.
Okay?
Your notes define these as space-occupying lesions within the skull. And the crucial thing to understand here, it seems, is that the symptoms a person experiences will really depend on where the tumor is located
Mm.
and how quickly it's growing.
Exactly. The skull is a rigid, enclosed space.
Yeah.
So any growth within it, whether it's a tumor, a collection of blood like a hematoma, or swelling, can increase the pressure inside.
Right.
This increased intracranial pressure, along with the direct pressure the tumor exerts on nearby brain structures, leads to neurological symptoms
Okay.
that vary based on the tumor's location and size.
Makes sense. You list common symptoms as increased intracranial pressure, an altered level of consciousness, headaches, seizures, and visual changes.
Right.
That's a fairly broad range,
It is.
highlighting the many different ways a brain tumor can manifest.
Yeah. For example, a tumor in the part of the brain that controls movement might primarily cause weakness on one side of the body.
Okay.
Or a tumor affecting the occipital lobe, which processes vision, could lead to specific types of visual disturbances.
Oh, interesting.
The rate of growth is also really important.
Okay.
Slow-growing tumors might allow the brain to adapt somewhat,
I see.
whereas rapidly growing tumors can cause a more sudden onset of severe symptoms.
Right. Treatment options here include radiation, surgery to remove the tumor, chemotherapy, and then some specific medications like dexamethasone, phenytoin, and stool softeners. So could you explain briefly why these particular drugs might be used in the context of a brain tumor?
Sure. So dexamethasone,
Yeah.
which is a corticosteroid,
Right.
is often used to reduce swelling and inflammation around the tumor,
I see.
which can help alleviate pressure.
Right.
Phenytoin
Yeah.
is an anticonvulsant medication used to prevent or control seizures,
Okay.
which are a common symptom associated with brain tumors that are irritating brain tissue.
Right.
And then stool softeners
Yeah.
are given to prevent straining during bowel movements,
Okay.
because any increase in abdominal pressure can temporarily increase intracranial pressure,
Oh, right.
which is something we want to avoid in patients with brain tumors.
Makes sense. Okay, let's move on to cerebrovascular accidents, or CVAs, more commonly known as strokes.
Okay.
And your notes define this as a sudden interruption of the blood supply to the brain. And you list several potential causes here: hemorrhage, which is bleeding, ischemia, a lack of blood flow, embolus, a traveling blood clot, thrombus, a blood clot that forms in place within a blood vessel in the brain, and vasospasm, a sudden narrowing of blood vessels in the brain.
Right.
So a stroke can happen either because something blocks blood flow or because a blood vessel ruptures.
That's the fundamental distinction.
Okay.
Ischemic strokes, which are the most common type,
Okay.
occur when a blood vessel supplying the brain becomes blocked,
Right.
either by a clot that forms locally, what we call a thrombus,
Okay.
or one that travels from elsewhere in the body, which we call an embolus,
Guy.
leading to a lack of oxygen and nutrients to the brain tissue.
Wow. Okay.
Hemorrhagic strokes happen when a blood vessel in the brain ruptures.
Causing bleeding into the brain tissue or the surrounding spaces.
Right.
This bleeding can damage brain cells directly.
Right.
And also increase pressure within the cell.
Oh, okay. You then outlined the potential neurological deficits that can result from a stroke, and that can affect sensation, movement, thought, memory, and speech.
Right.
And you make a really interesting point about the differences we might see between a right-sided stroke and a left-sided stroke.
Yeah.
With a right-sided stroke, you mentioned potential left-sided paralysis, agnosia, which is a difficulty recognizing familiar objects or people, poor judgment, impulsive behavior, and anosognosia, which is an unawareness or denial of their deficits.
Right.
That lack of insight into their own problems seems like it would be a significant challenge during recovery.
It definitely is. Patients with right-sided strokes
Yeah.
often have difficulties with spatial awareness
Okay.
and understanding their own limitations.
And this can lead to safety concerns as they might attempt tasks they are no longer capable of performing.
Right.
And it can also affect their willingness to participate in rehabilitation
Oh, wow.
because they don't fully recognize the need.
That's fascinating. So conversely, a left-sided stroke can result in right-sided paralysis, aphasia, difficulties with language, either understanding it or expressing oneself, and impairments in memory and intellectual abilities.
Yeah.
So while both sides of the brain are critical,
Absolute.
damage to the left hemisphere often has a greater impact on communication
Yeah.
and logical thought in most people.
That's correct. For the majority of individuals, the left hemisphere is dominant for language functions.
Okay.
So a stroke on that side can significantly affect their ability to speak, understand speech, read, and write.
Right.
It can also impact areas involved in logical reasoning
Right.
and memory.
You also mentioned transient ischemic attacks, or TIAs,
Yes.
as potential warning signs for a full stroke.
Fine.
These are temporary episodes where blood flow to part of the brain is briefly interrupted,
Right.
lasting anywhere from a few seconds to up to 24 hours,
Yeah.
with symptoms that are similar to those of a stroke. Things like blurred vision, loss of balance, aphasia, weakness, numbness, or paralysis.
Right.
So the fact that these symptoms resolve on their own doesn't mean someone should ignore them.
Absolutely not. A TIA is often described as a mini stroke, but it's more accurate to think of it as a critical warning.
Okay.
Studies have shown that a significant percentage of people who experience a TIA
Right.
will go on to have a full stroke, sometimes within hours or days.
Wow.
So anyone experiencing TIA symptoms needs to seek immediate medical evaluation
Right.
to identify the underlying cause
Right.
and take steps to prevent a more serious stroke from occurring.
Okay. Your notes then detail some specific neurological deficits that can result from a stroke. Hemiplegia, which is paralysis of one side of the body.
Right.
Hemiparesis, which is weakness on one side.
Yep.
Dysarthria, where speech is difficult to understand due to problems with the muscles used for speaking. And dysphagia, which is difficulty swallowing.
Right.
These can have a profound impact on a person's ability to function in daily life.
They often do. These are indeed common and often debilitating consequences
Right.
of stroke. Hemiplegia and hemiparesis
Yeah.
affect mobility and coordination.
Right.
Dysarthria can make communication very challenging.
Yeah.
And dysphagia carries a significant risk of aspiration,
Oh, right.
where food or liquids enter the lungs, potentially leading to pneumonia.
Right.
Now, all of these often require extensive rehabilitation therapy.
When it comes to the initial treatment for stroke, your notes emphasize securing the patient's airway in the first 24 to 48 hours,
Yeah,
which makes sense if there's weakness affecting breathing or swallowing.
right.
Then the long-term treatment really depends on the cause of the stroke.
It does.
Things like antihypertensive medications, anticoagulants, and thrombolytic drugs for ischemic strokes to break up clots. And medications like dexamethasone and phenytoin for hemorrhagic strokes to manage swelling and prevent seizures. And you have a strong emphasis on monitoring blood pressure here.
Right.
Why is that so critical in managing a stroke?
So in ischemic stroke, maintaining blood pressure within a specific range is crucial.
Okay.
We want to ensure adequate blood flow to the penumbra.
Okay.
That's the area of brain tissue around the core of the stroke that's still potentially viable.
Got it.
But excessively high blood pressure can increase the risk of further damage, especially if thrombolytic drugs are used
Okay.
in hemorrhagic stroke.
Yeah.
The primary goal is to control blood pressure to prevent further bleeding into the brain, which could worsen the damage.
Right.
So careful blood pressure management is a cornerstone of stroke care in both types.
Okay, let's turn our attention now to epilepsy and seizures.
Right.
You define these as sudden episodes of altered consciousness, motor activity, or sensory phenomena. You list a variety of risk factors here, including fever, cerebral edema, infection, brain tumors, hypoxia, and drug withdrawal,
Right.
which really highlights that a seizure isn't always a diagnosis in itself, but can be a symptom of an underlying problem.
That's a very important distinction.
Okay.
Epilepsy
Yeah.
is a neurological disorder characterized by a tendency to have recurrent, unprovoked seizures.
Okay.
A single seizure, however, can be triggered by a number of acute medical conditions
Right.
or external factors, as you mentioned.
Right.
So identifying the underlying cause of a seizure is essential for determining the appropriate treatment and prognosis.
Makes sense. You explained generalized seizures, which involve the entire brain. You mentioned tonic-clonic seizures, also known as grand mal seizures, where the body stiffens and then has rhythmic jerking movements.
Right.
Febrile seizures, which occur in young children and are triggered by fever. Absence seizures or petit mal seizures, characterized by a brief lapse of awareness. And myoclonic seizures, which involve sudden, brief, involuntary twitching or jerking of muscles.
Right.
It sounds like a wide range of how the brain's electrical activity can go awry.
It really is. Generalized seizures involve abnormal electrical activity across both hemispheres of the brain simultaneously,
Okay.
leading to the different outward manifestations that we observe.
Okay.
So the specific type of generalized seizure reflects the particular pattern and intensity of this widespread electrical disturbance.
Okay. Then there are partial seizures, which you categorize as simple and complex.
Right.
What's the key difference that distinguishes these two types of partial seizures?
The primary difference between simple and complex partial seizures lies in whether or not there is a change or loss of consciousness.
Okay.
So in simple partial seizures,
Yeah.
the abnormal electrical activity is localized to a specific area of the brain,
Okay.
and the person remains fully aware throughout the event,
Okay.
although they may experience localized motor symptoms, sensory changes, or emotional feelings. But in complex partial seizures, the seizure activity also starts in a localized area,
Right.
but then spreads to affect brain areas involved in awareness,
Oh.
leading to a change or loss of consciousness, even if only briefly.
Okay. Treatment for epilepsy typically involves pharmacological therapy with anticonvulsant medications. And you also mentioned the importance of lifestyle modifications, like avoiding alcohol and ensuring adequate rest.
Right.
It sounds like managing epilepsy often requires a comprehensive approach
It does.
that goes beyond just taking medication.
That's absolutely correct. Anticonvulsant drugs work by various mechanisms to reduce the likelihood of abnormal electrical activity in the brain.
Okay.
But lifestyle factors can also significantly impact seizure control.
I see.
Things like sleep deprivation, alcohol consumption, and even stress can lower the seizure threshold in some individuals with epilepsy,
Right.
making seizures more likely.
Wow.
So addressing these lifestyle factors is an important part of overall management.
That makes sense. Okay, now let's talk about back pain.
Oh?
And herniated intervertebral discs.
Okay.
Your notes state that this is a major cause of back pain, most commonly occurring in the lumbar or lower back and cervical or neck regions of the spine.
Right.
So the symptoms include pain, as well as potential motor and sensory changes like weakness or numbness in the legs or arms.
Yeah.
You also mentioned specific clinical signs like Lasag's sign and Kernig's sign. What do these signs tell a healthcare provider?
So Lasag's sign, which we often refer to as the straight leg raise test,
Okay.
is elicited by having the patient lie on their back
Okay.
and then gently raising one of their legs straight up.
Uh-huh.
So if this maneuver causes pain to radiate down the leg, especially below the knee,
Okay.
it suggests irritation or compression of a nerve root in the lower spine.
I see.
Most commonly, the sciatic nerve, which is often caused by a herniated disc pressing on the nerve. Kernig's sign is another test that can indicate nerve root irritation or even inflammation of the meninges.
Okay.
It's performed by having the patient lie on their back, flexing their hip and knee to 90 degrees,
Right.
and then attempting to straighten their leg.
Uh-huh.
So if this causes pain and resistance, it's considered a positive Kernig's sign.
Got it. So treatment for a herniated disc can range from conservative measures like rest, reducing stress on the back, and sometimes immobilizing the spine with a brace, to more invasive options like surgery to remove the portion of the disc that's pressing on the nerve.
Right.
You also listed medications like tramadol and methocarbamol for pain and muscle spasm relief,
Mm-hmm.
as well as lifestyle adjustments like weight reduction to reduce pressure on the spine, and modifications to activities like using a cervical collar for neck issues, sleeping on a firm mattress, sometimes using traction, and absolutely avoiding heavy lifting or twisting motions.
Right.
So it sounds like a very multifaceted approach to try and manage this condition.
Yeah, the initial approach for most herniated discs is typically conservative,
Okay.
focusing on pain relief and allowing the body's natural healing processes to occur.
Okay.
Surgery is usually reserved for cases where conservative treatment fails to provide adequate relief,
Right.
or if there are significant neurological deficits like progressive weakness or loss of bowel or bladder control.
Okay.
And then the lifestyle modifications are important, both for recovery and for preventing future problems.
Okay, let's move on to spinal cord injuries.
Okay.
Your notes list several potential causes here, including hyperextension, like in a whiplash injury, hyperflexion, where the head is forced forward excessively,
Right.
vertical compression, often from a fall landing directly on the head or buttocks,
Yeah.
and rotational forces.
Hmm.
And the general symptoms you list are quite significant, including loss of motor function, loss of sensation, loss of reflexes, and problems with bowel and bladder control below the level of the injury, and even the inability to sweat in the affected areas.
Right. So the spinal cord is the critical pathway for communication between the brain and the rest of the body.
Right?
So any damage to it can have widespread and serious consequences depending on the level and severity of the injury.
Right.
The mechanisms you described illustrate the different ways the spinal cord can be compressed,
Right.
stretched or severed,
Yeah.
leading to these functional losses.
Okay, you also mention spinal shock and neurogenic shock.